Welcome to new video, where we'll discuss a topic that could save lives: 5 silent symptoms of stroke. At first, let's talk about the term stroke. Stroke is a medical condition characterized by the sudden loss of blood flow to the brain, leading to cell death and potential neurological deficits. There are 2 primary types: ischemic stroke, caused by a blockage in blood vessels, and hemorrhagic stroke, resulting from bleeding in or around the brain. Stroke is a medical emergency. Every second counts, and recognizing the signs early can make a huge difference in someone's recovery, or even survival. While many are familiar with the F.A.S.T acronym, that means face drooping, arm weakness, speech difficulty, and time to call emergency services. There are subtle symptoms that often go unnoticed. Today, we'll explore 5 of these silent symptoms and explain why acting quickly is essential. Number 1. Sudden numbness or weakness. One silent symptom of stroke is sudden numbness or weakness, often affecting one side of the body, like the face, arm, or leg. This numbness might not always be severe, but it's critical to take it seriously. It happens because the brain isn't getting enough blood flow, which can cause parts of the body to lose sensation or strength. Let's talk about another potential early warning sign of a stroke. Number 2, that is confusion or trouble understanding speech. If someone suddenly seems confused or unable to follow conversations, this could be an early warning sign of a stroke. The brain's language center might be affected, disrupting comprehension. Research indicates that nearly 64% of stroke survivors experience communication problems, with about 30% developing aphasia. The presence of speech disturbances at the onset of a stroke is not only common, but also serves as a predictor of stroke severity and early mortality. In a study involving over 1,600 stroke patients, nearly 49% exhibited some form of speech disturbance at onset, with these disturbances correlating with higher mortality rates within 30 days post-stroke. Patients who cannot understand others' speech, receptive aphasia, often face significant challenges in social interactions and daily activities. Approximately 77.4% of post-stroke patients were found unable to comprehend spoken language effectively. Recovery from speech impairments following a stroke is highly variable and depends on several factors, including the location and extent of brain damage, the type of aphasia or other communication disorders present, the individual's age and overall health. Number 3, vision problems. Another silent symptom to watch for is sudden trouble seeing in one or both eyes. Stroke can impair blood flow to the parts of the brain responsible for vision. If someone experiences blurry vision, double vision, or even temporary blindness, it's time to act fast. Number 4. Balance issues or dizziness. Sudden balance issues or dizziness are also important warning signs. Balance issues and dizziness are common complications following a stroke, particularly when the posterior circulation of the brain is affected. Damage to the brainstem or cerebellum can disrupt the body's balance mechanisms, leading to persistent dizziness, vertigo, and coordination difficulties. Symptoms may include a sensation of spinning, loss of balance, and increased sensitivity in busy environments. Rehabilitation strategies, such as vestibular therapy, can help improve balance and reduce dizziness by retraining the vestibular system and enhancing coordination. Early intervention is crucial, as untreated dizziness can elevate the risk of falls and further impair independence in daily activities. Don't dismiss them as simple clumsiness or fatigue. Number 5. Severe headache. Finally, an unexpected, severe headache is a notable symptom in stroke patients, particularly in cases of intracerebral hemorrhage, where it occurs in about 50% of patients. In ischemic stroke, the prevalence ranges from 6% to 44%, with headaches often characterized as tension type or pulsatile, and they may be bilateral or unilateral, typically ipsilateral to the lesion. Headaches can arise shortly before or after stroke onset and are more common with posterior circulation strokes due to greater meningeal innervation. The underlying mechanisms remain unclear, but may involve activation of pain processing areas, like the insula and somatosensory cortex. Understanding the characteristics and prevalence of post-stroke headaches is crucial for improving patient management and treatment strategies. A headache like this is often described as the worst headache of their life. It may be caused by a burst blood vessel in the brain, which is a medical emergency. Why acting fast is crucial. Each of these silent symptoms might seem minor, but they're anything but. They're signals that the brain is being deprived of oxygen due to disrupted blood flow. Acting fast can save lives. If you notice any of these symptoms, classic or silent, don't wait. Call emergency services immediately. Time lost equals brain cells lost. By being informed and vigilant, you can protect yourself and your loved ones. If you found this video helpful, share it to spread awareness. And don't forget to like, subscribe, and turn on notifications for more life-saving health tips.